Polk. Good. Okay, I'll take number 2, approval of the agenda.
I so move.
Second,
I'll second it.
read a second. Okay, thank you.
Do we need to say all in favor?
All in favor? Thank you.
Aye.
Both same size. Sign. I always forget that. Okay, number 3, approval of the minutes for the November 14th, 2023 meeting.
So move. Approve.
Second,
Second.
I'll
Okay.
second it. I got the meeting minutes right here.
all in favor?
Aye.
Opposed,
Aye.
same sign. Okay. Public comment? Anybody up there? Okay. No public comment. Number 5, receipt information from supervisors not seated as committee members. Do we have anybody? Nope. All right, thank you. And number 6, public health and behavioral health presentation on substance abuse. We have handouts and Lisa and Ellen are gonna do it. Let me just say, I didn't say, Tanya's not here today. She has a family appointment that she had to tend to. So she wanted to be here, but she's not.
Thanks.
Madam Chair, can you take those handouts and put them in my mailbox and I'll pick them up then on Tuesday?
Yep, we'll take care of that.
Thank you, boss lady.
You're welcome.
Good morning, everybody. Lisa Lavassa, Polk County Behavioral Health. And Liz Watson from Polk. We want to take a few moments today to talk about our strategies in CSD for addressing the top 2 county board priorities. So we're going to talk about those in a little bit. We want to talk about harm reduction and what is it. And then we wanted to talk about what's happening in Polk County. What kinds of things and work is being done in Polk County to address substance use. So the top 2 county board priorities are increasing public safety and then also reducing substance abuse. CSD's focus has been to work collaboratively as much as we can across Polk County departments, healthcare organizations, recovery community, and then other stakeholders to combat substance use here in Polk County. No one entity is going to be able to do that successfully on their own. And our focus again has been to have that collaborative effort across stakeholders to reduce substance use.
First of all, I want to talk about what is a broad general definition of harm reduction. So according to the Center for Disease Control and Prevention, harm reduction is any behavior or strategy that helps reduce risk or harm to self or others. So here's some of the few harm reduction strategies that we're all familiar with already: seatbelts, sunscreen, helmets, condoms, designated drivers. And if we look more closely at how does harm reduction relate to substance use, we look to SAMHSA. SAMHSA is the Substance Abuse and Mental Health Services Administration. So that's the federal agency that's really truly the expert in substance treatment and recovery. So that helps guide the work that we do globally. So SAMHSA says that harm reduction is an evidence-based approach that is critical to engaging with people who use drugs and equipping them with life-saving tools and information to create positive change in their lives, potentially saving their lives. And harm reduction is present across the continuum of care for substance use disorders. So you'll see harm reduction embedded within prevention strategies, embedded in treatment strategies, and recovery strategies also.
Again, focusing on the board priorities. So again, harm reduction strategies are not there to attempt to minimize or ignore the harm or danger that's associated with illicit drug use. But rather it wants to acknowledge that it occurs and that it exists in our world. Fentanyl test strips are one of many evidence-based practices that are used widely across the US and the world as a whole. It does require federal, state, and local collaboration. Currently, 40 states in the US have decriminalized fentanyl test strips. Claire, if you can next slide, please. In March of 2022, Wisconsin has actually passed legislation to decriminalize fentanyl test strips as well. There were a number of lobbying groups that supported Senate Bill 600. They included law enforcement agencies, healthcare professionals, and government entities as well.
So again, harm reduction is just that practical approach that's an evidence-based public health strategy, and it's embedded within the prevention, treatment, and recovery work that we do. So we're going to dive a little bit deeper into what's happening in Polk County in prevention, treatment, and recovery areas, which includes the continuum of care. So in prevention specifically, public health belongs to the Northwoods Coalition, which is a regional substance use prevention coalition that's headed up by Marshfield Clinic. We also have local Polk County Community Coalition and action groups that's focused on substance use prevention, specifically with youth. We have school districts, faith groups, youth serving organizations, St. Croix Tribe, and others that are meeting on a monthly basis to talk about what is the problem in our county and how can we go upstream and prevent those trends from occurring. We also we're the fiscal agents for the Drugs-Free Communities Grant, which is aimed at reducing substance use in youth grades 6 through 12. And with this grant, we've done alcohol compliance checks this year. We also have a hidden in plain sight, which is an educational display.
Pardon the interruption. Folks that are watching this online are saying there's no sound at all.
Oh,
So I just wanted to. Sorry.
Hang on, Denise, we're working on it.
I got beautiful sound down here.
It's the sun.
Amy, I have sound. I can hear Johnny and everything that he's doing. So I can't hear the speaker whenever. So
Okay,
I asked that he be put on mute, please.
okay.
Thank you.
Mic in this room that's out. So we've got one mic over here and one mic over for the presentations. The mic that's over by the presentations is currently out.
Oh,
So we have
why don't we
good sound
move?
on this side of the room.
Why don't
with
you
the
guys move
presentation.
over here? Here, I'll just move
Yeah,
out
if
of
you
your way.
guys can move.
Denise, we're gonna move around a little bit to get to a mic that works.
That is not the issue, Amy.
Oh,
Johnny needs to be put on mute.
okay,
He's
I'll try that.
Yeah, every time there's a movement, he cuts out the speaker. Thank you. Sorry, Johnny.
And you guys might have to speak up since I guess that mic's out.
Sure.
All right.
Okay, so we're talking about the Drug-Free Communities Grant and the work that we can do within that grant. We have our Hidden in Plain Sight, which is an educational display that shows how substance could be hidden in rooms and in plain sight, I guess. So this traveling display has gone with other like educational resources, other traveling information, and we've presented at school sporting events, back to school events, parent teacher conferences, community health fairs, and other community events too. We also are doing a Small Talks and Real Talks campaign, which is also another state level campaign. Small Talks is aimed at encouraging parents to have those conversations about alcohol use with their kids early. And Real Talks is a campaign to encourage any community members to talk with others about substance use. There's also the Talk They Hear You campaign, which is through SAMHSA, and behavioral health has put those messages on the gas station TVs in Polk County. The Western Wisconsin Tobacco Free Alliance has put together yearly school resource packets, which is compiling resources about prevention, cessation, and diversion programs, and we share them with school districts. One school district has even started to implement Catch My Breath, which is a prevention program for tobacco specifically. And we have trained people on staff that can go out and train others on how to implement this program. We're starting to distribute Quit Kits, which is encouraging people to stop smoking, stop using tobacco products. Specifically, we're making kits for prenatal individuals and also adults. And then we just wrote a grant actually to get Quit Kits for youth. So it offers all the cessation and quit resources they need along with self-care items. We also are collaborating with Polk and Barron County and 2 hospitals with the Wisconsin Dental Pain Protocol. So really briefly, that's just a program to assist individuals who present to emergency departments with teeth pain. Instead of prescribing them opioids to go home, we are facilitating an emergency dental appointment for them. So within all these prevention works that we're doing, we're also doing harm reduction strategies, like our Narcan Direct program. So Narcan is an opioid reversal medication, and public health is able to go out and train individuals on how to administer Narcan, and then we're also able to provide Narcan kits at no cost. So I believe this year we've given out 317 of those. We also are able to distribute fentanyl test strips, the Never Use Alone hotline number. And then we're also thinking about how we are encouraging safe medication storage and disposal. So for individuals that do have prescription controlled substances, we want to make sure that they're destroying any medications that they no longer need. So we can give out Deterra drug deactivation bags. It's simply a bag that you put the medication in with water, shake it up, and it deactivates it. This year we've gotten 1,300 of Deterra bags into our community. So Meals on Wheels have handed them out, ADRC has handed them out, local pharmacies are handing them out with opioid prescriptions also. We've given medication lock boxes out into the community too, into recovery homes, foster care, again, ADRC. So it's to keep individuals that need to use those substances or medications so they can keep their medication safe in storage. And also we're encouraging use of the prescription drop box locations that are already established in our community, just letting community members know where they can drop off unused medications. And prevention in enough.
Let's talk about treatment. So as far as treatment goes, of course, we have Polk County Behavioral Health. And within our department, we provide outpatient substance use assessment and treatment. We also have psychiatric services that are provided on the outpatient department as well as in the jail. And one of the tools that we use through our jail psych and our regular psychiatry is a drug called Vivitrol. Vivitrol is a medication that is used for individuals who are addicted to alcohol. And so it works through the brain and helps block the receptors. And so we use that fairly frequently here in we also provide mental health and substance use crisis services. Our comprehensive community services program is a more intense level program for individuals who have mental health and or substance use. And then we also are our county's OWI assessment facility, and we do provide treatment for those folks. And we just implemented last weekend our first alternative education course that went really, really well. We were grateful for that.
What's OWI?
Oh, sorry, operating while intoxicated.
Thank you.
Yes, you're welcome. Another point I think that's important is DHS 75 is the statute, Wisconsin statute that governs certified substance use clinics. And that statute was rewritten and enacted in October of 2022. And a part of that rewrite of that statute was requiring anyone who might provide services in that DHS 75 clinic to be trained in Narcan. And we are, in fact, our whole division is trained in Narcan. So that way, if our consumers come in and they're at the front desk and they might be, appear to be overdosed, our staff can help them there. If they're in their treatment session, they can be assisted by their providers. If they're with economic support, the economic support team is all trained as well. In addition to that, DHS 75 also wove requirements in for tobacco cessation and offering that to individuals who report that they are using tobacco when they come in for plans. Programs for Change is an Amory Behavioral Health program, and that's an intensive outpatient program for substance use. They also provide mental health services. North Lakes Community Clinic also has outpatient substance use services, assessment and treatment. St. Croix Health has substance use treatment. Of course, there's the self-help groups, AA, NA, Al-Anon, Alateen, who are actively working on bringing Alateen into the community. and bringing a trainer in. And we actually just spent some time with the school yesterday talking about what that might look like in their school district. Of course, CJCC, partnering with them for the diversion programs that they provide and treatment court. And we work collaboratively, especially within the treatment court, to assess those folks and provide the necessary assessments that are required for them. Helen, I'm going to defer to you.
Angie Bimadizoin.
Thank you. That's a health center in Turtle Lake that is owned and operated by the St. Croix tribe. And they offer detox residential services. I believe they just opened up their doors. So we're learning a lot about them. So hoping we can bring that to you all in the future.
Any idea what that means?
Yes, like a healing place for all.
A changed life.
A changed life, yes.
And then Choose Health is a organization that's here in the US that has an evidence-based e-recovery app. It's called the Connections app. And right now, Polk County, Burnett County, St. Croix County are partnering with We Support Recovery to bring this into our communities. And what it does is it'll offer care management services for folks. Maybe it's 7 o'clock at night and their provider's not available and they need to talk to somebody. It also has 24/7 peer support. They have, group services, individual services. It's really a big endeavor. And it's a 3-year term that we would be bringing them in. We're excited about that. And then with regard to harm reduction, similar, again, it's woven into treatment, the Narcan Direct program, and making sure that folks are trained, that our staff are trained, fentanyl test strips, never use loan hotline, the Deterra bags, and we offer those to our consumers if they have a need for that. Generally, that follows through with our nursing team. The medication lock boxes, again, that's something that our nursing team would work with our consumers on. They know when they are on controlled substances, and then also recommending folks get rid of their prescription drugs using the drop box. All right, let's look at recovery for them. So some of the things that are going on in Polk County for recovery are some pro-sober and pro-social events, and I'm really proud to say that CSD Behavioral Health has taken a big role in that. We have been working, again, closely with We Support Recovery, the Mental Health Task Force. We have provided a tubing event where we pay for the pass for folks to go snow tubing up at Trollhagen. I believe last year we had close to 80 Polk County community members, kids, adults, as well as the recovery community. And then we also held a canoe and kayak event this summer, and we did it last year as well. That was very well attended. We just began offering Recovering Together cafes. It's a training that we use substance abuse block grant funds to train staff as well as some local partners. And they include individuals who are in recovery, could be recovery from substances, could be mental health, could be anything. And they allow the opportunity for people to have conversation together, to support one another in that process. These are monthly meetings. Actually, there's one tonight, and we're excited to say for the second month in a row that we filled it. We also provide childcare during that time frame. They're held here. We also provide have meals, so we have some of that connection time for people to be able to identify and meet other people that are in the same situation that they are. We Support Recovery has 135 active members in their recovery community. Partners for Recovery is a coalition that is a combination of providers. So we have the recovery community, we have Polk County Public Health, Behavioral Health, healthcare organizations across the county that are involved with that coalition as well. We share resources. The Deterra bags are an example of something that we share resources to make sure that they get out to folks in the community. I spoke of chess earlier, but that is, again, a recovery option for our consumers in our community, as well as Burnett and St. Croix County that are in the recovery and maybe need some additional help. There are recovery residences in Polk County as well. Angel Hands Recovery Homes has 4 units. And then there's, they have 4 units in Frederick, 2 in Century for families, and they have 2 singles and couples. Butterfly House is another organization out of St. Croix Falls that we use. Onyx Sober Living for men is located in Amory, but they also have a number of sober homes in St. Croix County as well. Again, AA, NA, Al-Anon, Alateen. Recovery coaches, we support recovery, actually has 2 recovery coaches, I believe right now, looking at doing a 3rd, and that's a partnership that they have with AmeriCorps to bring these individuals here to our community to help out. They've been spending some time in our jail, doing some recovery coaching with our inmates. And then that is also a partnership with Marshfield Clinic. So kind of just shows the broad collaboration that's kind of happening across Wisconsin alone. There are a number of recovery retreats. Many are spiritual based. There are shelter agencies, and then faith-based recovery support meetings. And again, all of the things that we have talked about before with regard to harm reduction, Narcan Direct program, the fentanyl test strips, never use alone, the doTERRA bags, the medication lock boxes, and the prescription drug boxes are all something we incorporate in that work that we do.
In conclusion, if we really want to move that dial or that needle and make meaningful change on the county board priorities, including increasing public safety, reducing substance abuse, it's really going to take that team collaboration, engagement across community partners, Polk County departments, healthcare, and the recovery community.
And just a reminder that, harm reduction is not used to completely stop or extinct, drug use, illegal drug use, or illicit drug use. It's really a reduction in the harm or the consequences of drug use, as well as saving the lives of the individuals in our community.
And the rest of this packet is for us to just go through.
Yeah, there's some supplemental documents,
Okay.
quite a few actually, that Helen and some of her team as well as us kind of put together just as kind of help us understand things a little bit more about what we talked about with the continuum of care and things like that.
Helen, can you go through your pond thing for everybody again? I think that's that's a good slide. I mean, that gets the concept of this multi-agency tackling this issue, I think.
So it's on page 16 with frogs in the pond. So the public health approach is, well, okay, I should back up. So the analogy is if I have a beautiful pond, I have frogs in my pond, I love my frogs. And one day I go out and the pond is muddy and scummy and gross and my frogs are sick. Like the knee-jerk reaction would be to grab my frogs, make them better, heal them. But if I do that and I put them back into that scummy, muddy pond, they're going to get sick again. So that's how public health is looking at our intervention and prevention programs. So we think of frogs as the individuals in our community. And yes, it's very, very important work that schools and hospitals and treatment places are doing to like save the actual individuals. But then we also need to use as a community collaboration to look at our pond or community and what are the policy systems, environments that are in place that continue, maybe encourage or another like factor, I guess, in making our frogs sick. So we need a healthy frog and we need that healthy pond. Community needs to be healthy and individuals need to be healthy. And unfortunately, you can't do one without the other. We need to do them both at the same time.
Okay, does anybody have any questions? Or there's a lot of these footnote pages are great. Thank you for pulling all those together. I was trying to.
Madam Chair.
Yeah, go ahead, Denise.
Thank you very much for the presentation. I have one question, please. I want to know, based on, I mean, I'm a black belt, okay, so I can't kind of function without numbers. You gotta give me numbers. And I'm curious, the Narcan kits, you said 317 were delivered. How many lives were saved? Do you document that? And what, even if we only know of one,
That's a very
you.
difficult number, just to pinpoint a specific number. We do ask when people ask for a refill of Narcan, we're asking that they tell us, what happened to your current dose or your current medication? Did you lose it? Did it expire? Do you need another one because you used it on somebody? Fortunately, I guess, most of the requests that we have is because they've been lost or expired. I was able to find on the Department of Health Services website, a compile, and this is on page 18 of your staff packet, information regarding Wisconsin ambulance run report. So the page I'm looking at, it has Polk County specifically, the Western region of Wisconsin, and then Wisconsin. And we're looking at the amount of times that EMS has been called to a suspected opioid overdose from January to October 2023. So in Polk County, in that time period, they've been 18 suspected overdose ambulance runs. In the Western region, 668, in Wisconsin, 7,489. And then if we look specifically at Narcan doses administered, Polk County 20, the Western region 451, Wisconsin 7,930. Unfortunately, this number doesn't capture if individuals are using Narcan also. So this would just reflect how many doses EMS has administered.
That would not include like your staff, the sheriff's department, or someone in social services. So just EMS. Okay. Does that help, Denise? Did we lose her? Oh. Uh-oh.
Nope, nope. So I guess Polk County, we've got, I'm gonna read that as 20 or 18 lives.
Yes.
I mean, assuming that all 18 were given Narcan and quite possibly some required multiple doses. Is that what I'm seeing there, ladies?
And that's not uncommon to have
Right.
give multiple doses.
All right. Wow. 20 people, huh? Or 18 people. Okay, great. Thank you.
Okay, anybody else?
Well, I don't know if it's a question, but it just strikes me that I don't know what number this is on, but it's all the people, all the different groups that have supported decriminalization of the test strips, you know, from Badger State Sheriff's Association, Police Association, Wisconsin Counties Association, and then all the healthcare. So it was striking to me how consistent, you know, when I looked at that, the range of those folks, that there's a vested interest in keeping people alive in this way, if possible. And then also just noticing like just the Wisconsin Deaths Association, you know, just that 40% of counterfeit pills contain enough fentanyl to be lethal. 40%, that's a lot. So to me, it's like there's a lot going, and that the increase in this drug coming into our community is striking. So anyway, those were that it struck me that the increase in the fentanyl coming in, the toxicity of that fentanyl, and the possibility that we could prevent harm.
The other piece that struck me is actually that people change their behavior. I didn't really know, you know, this is a bit of a new thing for me, and I didn't really understand that, you know, a person seeking an opioid or some other drug would actually change their behavior if they knew it had fentanyl in it. I found that striking in a pretty large numbers here. We don't have page numbers on ours, but it was.
Sorry, that was an oversight we realized yesterday.
That's okay. It's like the third to the last page. So anyway, I thought that was striking. 81% of those who had access to test strips routinely tested, and those who tested were 5 times more likely to change their behavior to reduce their use. I mean, I thought that was amazing. Okay. Denise, anything else? Ryan, anybody?
At this time, no.
Thank you.
Do you want to unmute Johnny just in case?
Yeah, let's check on John. Hang on a second. We might have a question from John. You unmuted.
It's on mute. I can't do it manually.
Oh, okay. Oh, he's muted on his end.
I asked him on mute, yeah.
All right, well, we'll come back to John if he has to he's blocked us on our end.
I think I got it. It says I'm unmuted now, so I'm okay.
There you go.
Okay, did you have any questions, John?
No, that's a very good report, and I just wanted to add that we're just so lucky, although, you know, we're on top of the problem that we've got. But down in this area, you know, the cartel really controls everything. You know, from the border to drugs to, they've closed down 3 of the borders, and I just saw on TV last night some people that came across and they paid the cartel like $10,000, and all this drug fentanyl money and everything, it goes to the cartel, and that's how our drugs and that are coming into Polk County.
All right, anybody else?
Tough
All right.
situation.
Okay, thank you. You're right, it's true. Okay, we're good? Questions? We're good? Anybody else? Okay, number 7, tobacco and alcohol compliance presentation. Is that you guys? Yep. Hi, thanks for coming, everybody.
All right, I'm gonna hand out some, so you have this here in front of me. So we'll start with that.
We just have a brief update on our past compliance checks this year. We'll start with tobacco. So from 2022 to 2023, we conducted 57 tobacco compliance checks with youth volunteers from our community.
Pardon me? Johnny, please go back on mute, please. Thank you.
Same thing.
Okay. Lose Johnny?
That's the same one.
He's too noisy.
One is the alcohol and one's tobacco.
And could you tell us who you are again?
Oh, yeah.
That'd be helpful. Just trying to, I know your face, but I want your name. Thank you.
I'm Felicia. I am an educator at the health department, and I run our tobacco.
Thanks.
Thank you. Thank you.
So going back, we conducted 57 compliance checks with youth ages 16 to 17 years old. Our youth went into our retail locations with their legitimate Wisconsin ID, because our goal is not to trick our retailers. And attempted to purchase tobacco products. And we do this in partnership with the Wisconsin Youth Program. Wisconsin has 3 main areas of focus to do community awareness and education. So that would be compliance checks, community partnerships, and the retailer training that they offer for free. Next slide, please. So just some background information. So our 2021 YRBS found that our overall high school population, 15% stated that they currently use tobacco within the past 30 days. And then if you look at our Wisconsin rate, which is on the bottom here, we are right in line with Wisconsin at 15%. So previously compliance checks were not conducted since early 2020 due to COVID-19. And then in 2022 to 2023, we found that 13% of our retailers sold to our underage youth. Next slide, please. And then this is basically just a breakdown of those handouts that you have right there. So we had a total number of 3 sales out of our 57 checks. 2 of those sales actually checked our use ID and still sold to them. And then 1 did not check the ID at all. Right there, we have a breakdown of our locations that actually did sell, and then our municipalities that did not sell. And then we did follow up with retailers that sold with education and a letter that notified them that they had a sale on this date.
Felicia, do you know what the trend of this is compared to our
So
pre-pandemic?
since compliance checks haven't been conducted due to COVID-19,
Yeah.
they have seen an uptake across the state in sales for youth. back up.
Do we know what it was pre-pandemic?
I do not.
Pretty good.
Thank you.
Okay, Madam Chair, question.
Yeah, go ahead.
When these letters are sent out, is there any, we know that there's no accountability, other than probably bad press. Do they respond to these letters?
No, I haven't yet to receive a response.
Great.
Thank you. Okay. Thank you, Felicia.
And I am Jason, also a public health educator with Polk County Health Department. I helped with the alcohol compliance checks, which is an important part of the drug-free communities grant. An important part of that is making sure that we have data about ways that our community is affected by substance use. So one of those key pieces of data is how accessible alcohol is to our underage youth. So for the alcohol compliance checks, we checked 38 locations, convenience stores, liquor stores, grocery stores all around the county. Used an 18-year-old volunteer who used their real vertical facing Wisconsin ID and attempted to purchase alcohol. All retailers were notified ahead of time by a letter that these compliance checks would be happening. All retailers, when we check, they do have signage stating no alcohol sales to minors. So if we go on, we can look at what we found. Next slide, please. Thank you. First of all, we're going to look at some just YRBS data, youth risk behavior survey data on alcohol use among our youth. Currently, or what the 2021 YRBS found was that 11% of Polk County middle school students reported current alcohol use, which is consuming alcohol within the past 30 days of the survey. And 52% of Polk County high school students have reported that they have consumed alcohol. So different numbers there. But if we look at the current alcohol rates, that's the bar graph on the side there. And Polk County is listed in gray there. So you can see that by grade, we're fairly consistent with national and Wisconsin averages. Somewhere around 35%, 36% of seniors report current alcohol use, so more than 1 in 3. And of course, that trends up with age among high school students. Next slide, please. So what we found with our compliance checks, it was not ideal. We found that out of the 38, 13 of our retailers sold to our underage buyer or underage volunteer. So over more than 1 in 3 sold, about 34%. Some of the locations where we had sales, Amory, 1 out of 6 locations sold. Balsam Lake, 1 out of 2. We did have locations that were closed as we attempted to buy, so we weren't able to check all locations. The Polk County Sheriff's Department also helped out with some of the compliance checks. So it's kind of a compilation of data between the ones that we performed and that they helped us with. In Clayton, 1 out of 2, so 50% of the retailers there sold. Luck, 2 out of 3 retailers that we checked sold. The 1 retailer that we checked in Dresser sold, and then 2 out of 3 of the retailers on the Polk County side of Turtle Lake sold to our minor. And then we had the most sales in Osceola, where 4 out of 10 retailers sold. So there was access essentially throughout the county. One place that we didn't have any sales, I believe, was St. Croix Falls, which is one of our bigger areas. So that was a positive thing.
Can I ask you a quick question, Jason?
Sure.
When you say 4 out of, like, for instance, Osceola, 10 retailers, are those grocery, including bars and grocery?
We did not check for on sale or anywhere that does on sale. It was all off sale locations. So liquor stores, grocery stores, convenience stores.
I was just trying to count up 10. I couldn't quite get to 10. I guess there must be 10.
There's a lot of locations, but also some of those some of those locations out by like Nye and stuff, I think count as an Osceola
You're counting,
address.
okay, yeah, because in town, okay, got it.
You had, this doesn't have much to do with the results, but you had one volunteer that did all these?
Law enforcement actually had a volunteer as well, so they did they did a number of the checks with one volunteer, and then public health did a number of the checks with a different
Like,
volunteer.
kudos to them, that's a lot of stress.
No, very thankful for our volunteers being willing to do that, and
Can't imagine
I can
doing it one
imagine it would be
time.
a daunting task for an 18-year-old to wanna do these things. Same with the youth that help out with our tobacco checks.
We usually do tobacco checks in 2.
Wow. That's a lot.
And these are results after they got a pre-letter that's gonna warn them, you guys are coming around and doing compliance check. That's amazing.
Yeah.
Is there must be a lot of overlap between the retailers, between alcohol and tobacco, right?
Correct.
Is there, I'm jumping the gun, but is it surprising that alcohol was more lax in their sales, or that's surprising to me.
It's surprising to me as well. I don't know if part of it is that the buyers that we use for tobacco checks are
They're different.
typically around 16 because state law.
State law for tobacco sales is 18, federal law is 21. So tobacco retailers get checked by the federal government and state government because we have 2 different laws.
So because state law is still 18, we have to use buyers that are under 18, and oftentimes just those couple years can make a bit of difference in a person's appearance. So that could be a factor. Not positive, but the 18-year-old buyer perhaps appeared a little bit older. I'm not exactly positive, but it is surprising nonetheless. And it is worth noting that the Wisconsin IDs for an underage, if we see here that 10 out of the 13 retailers who sold checked the buyer's ID. So they checked the ID, they still sold. And the Wisconsin vertical facing ID for an under 21 person right now, it says it in like 3 locations that the person is under 21. It says U21 on the top. On the bottom, it has under 18 until, and then the date under 21 until, and then the birth date in 2026. So it listed in multiple places there. 3 of the locations just didn't check ID at all.
Are you educating the sellers that federal law is different for alcohol than tobacco?
Yeah, they all receive education through the tobacco program about the state statute and federal law.
And how do you choose which places to go? In, with in both of them, how do you make that? Is it different
For
ones each
tobacco,
time?
The Wisconsin WINS program has us do a certain percentage, so we did have to check a couple bars for tobacco that still sell, because 10% of our checks have to be.
I see. So, Okay.
For alcohol, we at least attempted all off sale only retailers. So we at least made an attempt. Some were not open, as sometimes the hours can be a little bit difficult to get in, but everywhere that we were able to check, or if an issue occurred where the buyer happened to know the person who was checking them out or something, then we would abort mission. But because then it's obviously not a valid compliance check at that point. So it does serve, hopefully an important role in both data collection for understanding ease of access, but also hopefully for prevention, as we did send out letters to all of the retailers that did, well, we sent out letters to all retailers, whether they passed or failed the compliance check. And then Caroline actually reached out with this information to all of the local licensing jurisdictions. And then kind of put it in their hands, since they're the ones that handle the alcohol licenses, so left it up to them. So we were using it on our end as an educational piece, and then any other ramifications were left up to the individual jurisdictions.
Madam Chair?
Press release too. About a compliance check.
Go ahead, Denise.
Okay, question about accountability. So you give the letters over to the local licensing agencies. Do you request follow-up?
Caroline, you have answer to that, because you were the one that I know reached out to the local jurisdictions. I know that some of them replied with questions, they wanted further clarification. And we essentially just provided them the information, so that they could handle it, is my understanding.
We decided not to proceed on a county level to fine or ticket or provide any sort of physical repercussion other than education. When we reached out to the municipalities, I just simply stated the facts and they replied wanting more information, and then they were going to personally follow up with tickets on their end. And most of the municipalities that sold did choose to do so, but not all of them.
Denise, can you hear that?
Yes, I can, and drugs are drugs.
Thank you. Okay.
So we do have the press release in front of you as well, which will be going out to kind of give notice to all of the establishments that we are out there. We are doing this. Multiple locations, failed these compliance checks. Hopefully increase diligence. Back to the Helen's frog and pond analogy, hopefully the tickets oftentimes will go to the individual seller, but we're hoping that, the culture of the establishments here can change, and that the training of staff, the culture at these places, because there are certain establishments, I'm not gonna say individual names, but there are certain establishments where you can tell they have that culture and just sales are not gonna happen. It's just not a thing that will happen at those places. So we know that having that culture in those retailers definitely makes a big difference.
And I see the fine is 450 some bucks, and that if it's levied, it's against the individual who sold.
Yes, correct.
Have those been collected? What's the story? Is that, as far as you know?
So I think historically, Public Health has done alcohol compliance checks, I think most recently in 2019. And we did collaborate with the Sheriff's Department at that time to do the checks. And I believe we wanted to do more of an education approach. So if the individual sold, they could be offered to come to a class, and then the fee would be decreased, the citation. I think this year, because it had been so many years since we've done checks too, that we decided to keep it as just educational this year, and then next year we'll revisit. There might be some municipalities that choose to do differently, and I'm not sure then what their citation rate would be.
They were slightly lower, but again, varied by municipality. The sheriff's informed me.
And has anyone if the citations were to go to the particular store, might that help the culture versus a one person? Like, it's not really necessarily, it might be a cultural issue versus a single person's issue, single seller's issue. Do we know anything about that at all?
I am not like the expert in citations, but I believe it's like legally it needs to go to the person who sold versus the owner.
Okay.
So the old saying, what's measurable is manageable. Is it worthwhile for us to collect and just kind of aggregate what municipalities are doing in response to things like this? So moving forward, we know where there are responses and where there are not. So if there's gaps, we can look at addressing those if we need to. Is that something that's already happening, or?
Yes, so since we've only done alcohol compliance checks in 2019, we can take that data, comply with this, and we're just now.
Yeah, so the
more
COVID
goals.
gap threw a wrench in things. And now that we might be able to get into more of a cadence of doing these on a regular basis, we can figure out what municipalities are acting, what ones aren't, and if there's anything that we need to do on our end.
Correct.
Okay, perfect.
And we did have a little bit of difficulty collaborating with the Sheriff's Department to make sure that we could get all of them collaborated together. And it does get difficult on like the citation end. If we don't have law enforcement right there or the Sheriff's Department right there, because oftentimes we can't identify the individual seller as well. So they won't have a name tag on, and all we can get is a description of the seller. But I believe Sheriff Walk actually had a comment about the.
But yeah, so then the follow-up then is that you go in after and see the blonde hair, blah, 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 and give a citation to that person based on their descriptions? Is that how that works?
In the past, when we did it in 2019, yes, the person who sold, the deputy, after the sales made, goes in, identifies them, gets their ID, and then a citation went out. And unfortunately, it would be nice to give the establishment the ticket, but it has to go to the person who sold. And, you know, if you look at around the gas stations right now, most of them are stressed for staff. And the thought even then was, this is the high school kid that maybe didn't know any better. And the education was even offered at a reduced price if they brought their store manager in and brought the establishment people in so that they could learn of the dangers of this. So, yeah, it's unfortunate to have to give some 18-year-old clerk a $500 ticket.
Yeah.
And maybe they haven't been coached.
Yep.
Maybe they haven't had the right training. So
Is that a
stepping into
state
this.
statute that it has to go to the
Yes.
seller?
So that's disappointing because that's not the goal, is to financially strap the clerk. The
Right.
goal is to get compliance. So the education piece, I think, has been valuable. We're short-staffed as well, and that's why I don't think these last rounds went as well as in 2019. In 2019, I was able to, dedicate a deputy to go around and do every one of these.
I
And
see.
They can take
Okay.
action right there.
Okay, so we were short, okay.
And then ideally, if we can get those citations out, hopefully that leads to them attending the educational class. Instead of actually receiving the big fine, we can actually get more intensive
Because those fines,
education.
do we know who pays those fines? Do the stores pay the fines? Because it's the person, right? It's the poor high schooler that's trying to save for college or whatever they're trying to do. Okay,
kid.
see,
How much reduction if they take the education about?
I would say it was more than half, like it was a significant, yeah. And then, right, if they brought in a manager, then it was even decreased more.
I thought it was like $125 or something. If they brought the manager, then it was 75. It kept going down to
Great.
get more people from the store involved.
Yeah, and if I remember correctly, that again was a really fun collaborative effort between the CJCC. I think that the DA was a part of that as well as the sheriff. So agreed upon that would be the case, that there would be that reduction in the fee. They attended class.
Well, the press release doesn't say that they have opportunities to be educated. Which is our goal, to educate the sellers that there's state and federal laws involved, both tobacco and alcohol. And so, and the fines can be reduced by attending education.
That was all sent in an individual follow-up letter to retailers, correct?
Yes, also with the, since the county didn't issue citations for this round, the class to reduce the fines isn't available for this round of compliance checks, which hopefully, hopefully staffing issues improve.
But I think that portion of the importance of educating the seller should be in the press release. So think about that.
yeah, add that later, okay. Thank you. Anything else? Anybody else?
Can I make one comment?
Yeah.
I will say, and obviously we don't want to name the name, but I think it is an establishment issue, because one certain business had perfect record both with tobacco and alcohol. And they're a business that's known to be on the cutting edge of training and employee support. And I believe their store even does their own checks. So I think the way to attack this is at the management level of the store, so that they fall in line and get their people up to par.
And on the other end, we did have the same store fail for both alcohol and tobacco.
Yeah, it's a culture thing.
Yeah, back to your culture point. Rita, did you have something?
Oh, yes, I agree.
I mean, being that it's positive, are we able to discuss who the successful one was? I have a pretty good guess.
Well, I'll leave that up to public health. I mean, I don't have a problem with it.
All right,
It's just a big.
Yeah, so,
Yeah.
Quick Trip with all of their multiple stores in the county did not have any sales for alcohol.
They also do their own in-store shoppers, so they're getting checked. by
They make it a
state and
priority.
their own, so.
I'm sure there's a question over there.
Do you see? Oh, sure.
Oh, can you hold that thought?
Go ahead.
Oh, go ahead, Carolyn.
I was just gonna add, and another big point behind sending out this press release is just to let everyone in the community know that this is happening, because it is public data and they deserve to know what's going on in their community. And we hope that by continuing to be transparent with this data, that a sense our community kind of rallies behind this and sees that it is a problem and kind of holds that personal accountability to their neighbor kind of thing.
Yeah. Bill?
I was gonna say, Jason, that when you do your compliance checks, the chain stores like Quick Trip compared to the mom and pop locations? The mom and pop locations are the ones that are selling,
Some,
Not all of them,
But-
not all of them?
no.
or some that were quite diligent that
Okay.
the volunteer buyer would come out and report that they were extremely diligent about it, that they were just like, oh, like as soon as the person would start to bring it up, they'd be like, do you have your ID? And be right on top of it and check it diligently. So it definitely, depends on the location.
What does a liquor license go for?
Good question.
I do not know.
$1,000 for on sale.
Or on sale? What about off sale?
We got, I think they're the same.
Okay.
This is a local
Right.
control township.
So if you go in for a compliance check and you have a threat of taking a liquor license away from a particular store, that would be huge to them, from either tobacco
Oh, yeah.
or alcohol.
That would be, your township issues them every year, so
Okay,
they would be the one to contact if you run into a serious problem with.
That's why we supplied the businesses that did fail to the municipalities, so that when they are looking at licensing for the next year, they have the list of people to watch a little closer.
I don't recall a recommendation one way or another,
There was,
but we pretty much know.
can you, is this only, this is annual? Is there any way to have resources for a 6-month loop back on the bottom 20% or something?
We'll be doing tobacco compliance checks starting this spring into June.
Summer is the plan for.
Yeah.
Compliance checks. I mean, there's a possibility that, public health could go out and maybe do our own more frequently. I think that it might be difficult for the sheriff's department to dedicate a deputy.
Yeah. Yeah, I just thought the bottom ones, I figured it was an annual thing and that's all we have staff for, but just that bottom tier. So. Anybody
Also
else?
difficult to get for alcohol specifically, because you need an 18-year-old or a 19-year-old and they're all at college.
They're all school.
So that's why
Tobacco
summer.
is difficult as well. That's why we're doing it one time this year. Usually we split it in half and do first 2 quarters of our fiscal year and last year. It's so hard to get high schoolers to even volunteer to do it, so we're grouping them all together too.
It's impressive that you get anyone. I'm so impressed with whoever does that and
Don't
takes
say
their
it.
time.
It's your staff's children.
They're incentivized.
They get paid.
They don't get paid.
They
They
get, no, they get paid by their
get
family.
paid with
Madam Chair,
They get
Yeah, go ahead,
paid.
Denise.
Denise here. I would just like to say that something, addiction is in many forms, and we all live around it in our daily lives. Some addictions affect us more than others, but it is a culmination of all of these activities that bring change and reduce the threat of addiction. And once we pull behaviors and culture, enculturated people by the bootstraps out of the abyss that allows addiction to occur, we're not gonna have any effect on addiction and addiction as a whole. I don't care what your drug is, whether it be a behavior or of physically ingesting something. It's willing to put up with the behaviors that allow addictions to start. I could buy beer when I was 16 years old, and it doesn't surprise me that kids can still buy beer today. So until we get serious about addiction and using all of the available tools to stop it, no matter where it comes from, I could care less if it's coming from a border or an outer space. The addiction affects us in our lives, and that's all I have to say.
Thanks, Denise. Anything else on the compliance checks?
Just one more quick question, and thank you. This is really good work you're doing, and it's not easy. It's really helpful to know. I'm also, am I right in Wisconsin being near the top of the list for binge drinking and nationally?
Yes.
Are we like what, number 1, 2, 3?
We're in
I believe,
Many of our counties are like in the top 10 and by
In-
county ranking.
including Polk County as far as that.
Yeah. So that's just.
Tell the Minnesotans to come over.
And also. I don't recall.
Claire, do you want to?
Yes, so along that kind of same sentiment, the age of a person's first drink is strongly associated with a higher risk for substance use or substance abuse, so why it's so important to address these issues with the sale to underage minors. Consumption can slow brain development, may permanently impact memory, attention, decision-making abilities. Alcohol use is linked to higher rates of depression and anxiety, so just kind of the last thing.
Do we still have the thing in Wisconsin that if you're with your parents, you can drink in a bar?
By establishment.
By step?
Yeah,
What
your
does that mean?
establishment can choose to honor it or not.
Oh, establishment decides to, and that's, okay. Okay, anything else? Thank you very much for all that work and for all the slides and the handouts. Appreciate it. Okay, moving right along. Number 8, discussion and possible action regarding resolution 4823, resolution to support law enforcement ban fentanyl test strip distribution. This is for this agenda item. I need a motion to bring this to the floor. Okay, hearing none, we will move on to number 9. Do we have Nina on from Golden Age Manor? We can come back to her.
Oh, yes, she is.
Oh, there she is. Okay. Dana, can you hear us?
Hello, sorry, I just got, can you hear me?
Yeah, there you are. Go ahead.
Good morning.
I can hear you.
Hello. I don't have an update yet for you, but I certainly will. I can say, I think with certainty by the January meeting, so nothing's been changed or finalized yet as far as that funding we were talking about, so I will keep you guys posted as soon as I hear.
Okay. Any inkling, but nothing probably, huh?
Not really, no.
Okay. Anything else you want to update us on? Otherwise, we can let you go.
I don't think so.
Have a great holiday. Thank you for popping in.
Yeah, thank you.
Okay. Okay, number 10, command center update, status update.
I can give you a really quick update.
Okay.
The sheriff's department's got both units right now. They have the wrap off the one that was donated from MediHealth. So right now they're just evaluating both units. I believe they put a new windshield in and some new tires on the new one. So right now they're just evaluating the condition of both units. And that's the status.
And do we have a time on?
We do not have a time frame
Okay,
yet.
time frame. Okay. Questions, anybody? All right, number 11, CWD testing box update, which is on site, I understand, somewhere.
It is. It's just located on the east side of the building. As you come down the main drag there, there's a cooler there and a big red sign.
Okay.
And then once the deer heads are placed in there, typically DNR is in there on Sunday, a couple times a week to pick up those deer for testing.
And do you need the whole head?
I don't know. I'm not
Or
quite
the
sure
brain?
on that.
Okay.
If you go to the environmental services website, Logan has a nice video presentation
Okay.
on the testing center and the process on going through to get your deer tested for
Okay.
CWD.
Any
Do we
sense
know
of how?
many,
Yeah, I had the same question.
do we know how many people are testing their deer?
It's rather low, but I don't have that number. I talked to Michelle last Sunday.
Have we put out, has the health department put out any education on chronic wasting disease? in newspaper articles, 'cause this is because this is not your typical bacteria or virus. This is called the prion disease. It was discovered by Stanley Prosner, who actually got the Nobel Prize in medicine about 20 years ago. And because this is what causes mad cow disease in England, it causes chronic wasting disease in the United States, it causes something called Creutzfeldt-Jakob disease in humans who contact the prions from meat, and this is also in Far East. And I know that some 30, 40 years ago, there was a Lutheran pastor that went on a world tour in the Far East and ate some wild meat or something and contacted Creutzfeldt-Jakob disease and perished very quickly. So this is a real thing, and so it's we need to educate our hunters that, hey, get your meat tested, you know, at least, I mean, that's a simple thing to do.
Dr. August, do you know if, can you kill it by cooking it?
No.
It survives
No,
temperature,
I
okay.
took care of people at Mayo that had it, and the prions are non-treatable. Once you have it, it's terminal. It's terminal.
Right.
Don had a comment on that, did you?
I think there was 224 deer tested in Polk County as of yesterday.
Under
Thank you,
24.
And you need the whole head and you need part of the neck because you want to get the lymph nodes. That's
Ah.
why
Okay,
So no big bucks would be tested ever, cause.
right.
you can skull cap them. And they actually, I think there's instructions on them that say that you have to remove the antlers before you put them in the box.
Tangle mess.
Question. Of
Yeah.
that 224, were they all negative?
One tested positive, like early archery season in the northeast part of our county,
Wow. Okay.
the very northeast tip of our county. That's what DNR.
But to your point, it's probably unlikely that somebody that gets a real big buck is gonna submit it for testing, just behaviorally. But it's just a guess.
I'll comment. People feel it's punitive to get their deer tested because then they ban baiting for 3 years. So a lot of people avoid the testing. So I think that's something to think about, you know, and that's at the state level. They have the state law on that, but I know there's been game farm deer that test positive, one in Washburn County, and that shuts the whole county down to baiting. And people are opposed to that. So I think you'll see a lack of compliance until they do away with that. Oh my God, we're gonna lose the baiting.
Isn't baiting illegal in Wisconsin to begin with?
No.
Feeding like feeding them?
Yeah. There's also that correlation between the game farms and wild deer game populations. Because game farms are regulated not by the DNR. They're regulated by someone, another entity. And they've been very opposed to the double fence laws and stuff like that to contain those herds. So it is a struggle between the two entities because many of those first cases came from game farms on that and not our wild populations.
So like Ponderosa?
More of the game farms that have the hunts, I believe, and the bigger all fenced in, that type of stuff, not particularly a zoo type area.
Sorry.
Yeah. Okay, anything else on that? Anybody else? Okay. Okay, number 12, update regarding housing.
Right now, the applications are out online. We have not received any applications yet for that $200,000 for that new program that the board passed. I believe Ryan attended a meeting last night that may have potentially 2 applicants. But we have not received those at the.
Because it's just a rolling deadline. It's not a deadline.
Right,
So
correct.
it doesn't, yeah, I'm not, okay. Okay.
It's something, if I can bring it
Yeah,
up
go ahead.
too. I just brought up that, say we have the good fortune of applications start coming in, and we have that limit of $200,000. And again, this imaginary scenario where we have to accept and deny different applications. I feel like I brought up to that maybe we should come up with a formal process of acceptance and denial. So if municipality A gets accepted and B gets denied, and they ask why, we have a way to tell them the process. Cause I think right now, unless I'm missing something, it just comes in. And I don't know what happens after that.
Before Vince left, Don, Vince and I, were you part of that? I think it was before the before you were hired or decided on, we met and put down criteria that we would judge, and by we, I mean the county, not us specifically, but and I believe that that was the intention at that point, was to use that criteria, and I believe that Vince brought it to a committee and talked about those criteria. So let me try to find that.
We had it here.
It wasn't here.
Even, and I understand that, and even with those criteria, then wouldn't we need to say that it's, you know, in the order received or something like that? Cause say they all meet the criteria. then
Oh,
what-
sure.
Then what do you do?
Yeah, if they all meet, I mean, right.
Oh, yeah.
I think you're correct, as I talk with Don and stuff, as a really rolling deadline, you really can't hold them all until a certain point.
Right.
And
And
then issue
evaluate.
them. You know, if we get one in the next several months, would be prudent for us to move forward with that one, so.
And again, this is we just kind of have to be a little bit forward thinking, because maybe it happens and maybe it doesn't. But if we do start getting applications rolling in, that'll be a good thing, because then we can have the discussion about what we want to do overall, so.
Okay, thank you, everybody. Okay, number 13, communicable disease. How we doing, Helen?
November 2023, the first full month where COVID and RSV have been kind of reclassified as how we're tracking it. So now we're only looking at 24-hour or hospitalizations for at least 24 hours. So COVID, there was 9 in November and 2 RSV and 1 influenza, looks like. And then we just have very consistent from this November to 2022 November. The chlamydia is 4, syphilis 1, hepatitis C 2, so everything else is unremarkable, I guess, pretty status quo.
So we're tracking hospitalizations now, so we can compare apples to apples. Okay.
Yep.
Yeah, and the reason we're tracking hospitalizations is because that's the only valid criteria there are. Well, the hospitalization and deaths from COVID. Because most people are testing at home.
Right.
The government is still giving free test kits for COVID that you can get from the US government. So that's Mike Osterholm says those are the only valid criteria.
He doesn't like wastewater treatment plant
It
testing?
doesn't matter because the case numbers are so unreliable because people are testing at home and they're not reporting them if they're positive.
No, people are.
Right. Okay, question, we're good, thank you. Okay, legislative report. John, do you have anything to update us on that you did in the last month?
I do not. There won't be any of the steering committee meetings until March. And I'll be back and I'll be attending those steering committee meetings.
Thank
I
you for doing
do,
that.
you know, I get a report from the staff and there isn't anything new on the staff. Amy, before we adjourn, I wanted to make one more comment on this alcohol. I think the biggest deterrent that all the establishment have that sell alcohol is their insurance. If there's an accident and there's somebody that is underage and has purchased, you know, most of the time that establishment that is responsible, many times it even goes above and beyond their insurance. So of the people that I know that are business people, they want to protect their license and they care about the things that can happen. They're well aware of the things that happen with that are alcohol related, and so that's the biggest deterrent, I think, that they're trying to live up to their obligations.
Yeah, thank you.
Madam Chair.
Go ahead.
We'll say, last Wednesday, since, financial health kind of directly impacts people's actual health. I was able to attend the bill signing in Madison of a bill that now requires a 1-semester personal finance course for students.
Oh, good idea.
Alex Dahlman in the Madison area, he was the sponsor of the bill. And it took a number of years and a lot of people school districts are a little bit leery of it because it's another graduation requirement. But community support in general is very high, just because if you ask somebody, should a student have a good grasp on being a good financial steward for themselves, people are mostly gonna say yes. So that got put into law last Wednesday. So the graduating class of 2028, so next year's freshmen will be the first class to have to take a 1-semester personal finance class before graduation.
Great.
I'm pretty happy about that because that's my professional life. So.
Yeah, that's a good update. Okay. Cool, okay. 15 is review the work plan. You see it's kind of laid out a little bit differently. I don't know if we don't have Tanya with us. This is pretty much like we did last year. If anyone has anything.
She's on now.
Oh, hello, Tanya. I don't know if we have anything particular that you want to add. We can obviously flush out each of these things when we develop our agenda for the next month. But if anything strikes you that you want us to tweak in whatever October next year.
Madam Chair,
Yeah, go ahead.
I noticed that there's a VSO mid-year report in July and September, so that's the only
Oh, yeah.
input I have.
We were gonna dial him down a little bit and not have to have him come. You're saying he should just come in September at the mid-year?
No, there's two mid-years. There's one in July and September.
Oh, yeah, yeah, yeah.
March.
And March.
Mid-
Yeah.
July and September and November.
Oh, yeah, this is supposed to change. Okay, we'll get that changed, because that was what we talked about with him, that he didn't need to come so much. Yeah.
Yeah, right. Oh, so mid-year indicates to me one of them. So to have two mid-years is kind of weird. All right, thank you.
How about if we just ask him how many he feels he wants to give us beyond one and mid-year, and we'll go from there.
Yeah, there's 4 on
Okay.
there. Yeah.
Anybody else notice anything like that? Okay. All right. Number 16, identify subject matters for January 9th meeting. Anybody got anything? I can't think of anything off the top of our head. You?
No,
Okay.
not for this one.
All right, I'll take a motion to adjourn. Second? All in favor? Aye. Pose same sign. Thanks Denise, John, and Tanya, whoever's online, and Sabrina. Bye.